Hello everyone, and thank you for joining us today for our webinar on Introduction to Patient Engagement and Integrated Knowledge Translation. My name is Denise Thompson, and I am the Associate Director of the Alberta SPORE Support Unit Knowledge Translation Platform. I will be moderating this session. I would like to introduce you to our presenters today, Diane Duncan and Lisa Petermann. Diane works as the Program Coordinator of Training and Professional Development for the Alberta SPORE Support Unit Knowledge Translation Platform. Diane brings a wide array of academic and pragmatic skills to facilitate this talk, including a background as a clinical pharmacist, training in project management and adult education, and experience implementing knowledge translation activities, including academic detailing initiatives, audit and feedback interventions, opinion leader sessions, and educational events. Lisa works as a program coordinator for the Alberta SPORE Support Unit Patient Engagement Platform. Lisa brings a wealth of experience in both patient engagement and knowledge translation. She has held various leadership positions in both government and not-for-profit organizations at the provincial, national, and international levels. Perhaps most relevant, Lisa co-authored a pragmatic KT guide for mental health and co-designed the how-to guide for integrating the patient voice into health research. She is an energetic facilitator who uses session design to give participants a better toolkit for hosting their own engagement events. Before we begin, I'd like to mention that this session is being recorded and that the link will be provided along with the presentation slides to all participants after the webinar. The format for today's webinar will be approximately 40 to 50 minutes of content with time for questions afterwards. You can send your questions throughout the presentation by typing them into the chat screen, where they will be addressed by the presenters at the end. I hope you enjoy today's session. On behalf of the Alberta SPORE Support Unit Knowledge Translation Platform, I would like to extend a warm welcome to Diane and Lisa, and will now hand the microphone over to them.
Hi, welcome to our webinar today. This is Diane, and so at the end of our webinar, hopefully you'll be able to explain patient-oriented research in your own words. You're going to be able to compare patient engagement to integrated knowledge translation and explain why patients and knowledge users should be engaged in patient-oriented research.
Good morning, everyone. It's Lisa. Thanks for joining us today. To get us started on that first learning objective, patient-oriented research, as described by the Canadian Institute for Health Research, is a continuum of research conducted by multidisciplinary teams. And really, you need to have three components present for it to be patient-oriented research. So engaging patients as partners, really looking at patient-identified priorities, and improving patient outcomes. And once you've done that, it's really applying that knowledge generated in a way that will improve healthcare systems and practices. So I think just to level the playing field at the start, who are patients? What we like to say is that they're not just the people who have had a personal experience of the healthcare issue and they're more really informal caregivers, including family and friends, as well as those people who have had a personal experience. So if that's who patients are, what really is engagement? So engagement is a process of encouraging and enabling individuals and teams to participate in research. And so today we're going to really dive into who should be engaged at a high level, at a detailed level, and then also why you might want to do that, and then how you can actually go about doing that in a meaningful way.
So who are knowledge users? Knowledge users are all those individuals or organizations who might use, benefit from, or be impacted by the results of research. And so if you're familiar with project management, knowledge users are very analogous to stakeholders. And knowledge users include a wide variety of individuals, so they may include researchers, patients, healthcare professionals, or service providers, general public, health system decision makers, policy makers, industry, media, research funders, and community. So when we look at the wide depth of who knowledge users might comprise, it's very important to look at the context of your individual research to identify which knowledge users you would want to think about engaging. And again, it's important to remember that patients are a specific category of knowledge users. So as Lisa stated, one of the goals, or the primary goal of patient-oriented research, is to apply the knowledge that is generated to improve healthcare systems and practices. And knowledge translation are the methods for applying this knowledge, for closing the gaps from what we know to what we do. The CIHR definition is much more complex. They define knowledge translation as a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve health outcomes. But I think if you keep in mind that really this is the dynamic, iterative process to use methods to close the gaps and to take what we know and make it into what we do. So you've probably heard the term integrated KT. Integrated KT is just an approach that engages knowledge users in the research process. The central premise of integrated KT is that by involving these knowledge users as equal partners alongside researchers, the research that's generated would be more relevant, more credible, and more useful to the knowledge users. Integrated KT actually has a really long-standing tradition in many disciplines, including education and the social sciences. It just goes by different terms, such as collaborative research, participatory action research, or co-production of knowledge. The CIHR states that at minimum, integrated KT is where researchers and knowledge users together shape the research question, interpret findings, craft key messages around the results, and move research into practice. And why this is important is because engaging knowledge users in the research process helps close the no-do gaps by making sure that the right knowledge is produced. So once the right knowledge is produced, crafting these messages, disseminating or implementing results are the activities that comprise or are the foundation for your end-of-grant KT plan. So end-of-grant KT are really just activities used to inform knowledge users of research findings and to move research or results into practice. But there's a continuum of these activities, from activities that are quite passive to those that are very active. And there's a corresponding increase in the resources and the effort required as you move from a spectrum of passive to active. So for instance, diffusion, just letting it happen, this would be an example of publishing results in a peer-reviewed journal. Dissemination, helping it happen, would be an example of where you have a body of evidence around some primary studies that are synthesized and you create a clinical practice guideline. Implementation requires the most resources and the most effort because you're making things happen. An example would be where you create EMR reminders or clinical pathways around a clinical practice guideline to actually make it happen. So it's really important when you're looking at end-of-grant KT activities to ensure that the right activities are chosen based on the research and the needs of the knowledge user. So when we look at knowledge to action gaps, the first gap that occurs or may occur is the knowledge production problem. And this is when the wrong question is asked. The research itself does not address the priority questions facing clinicians, managers, and decision makers. And the way to solve this is through integrated KT. By engaging your knowledge users from the get-go, you will hopefully identify questions that are important and relevant to your knowledge users and create evidence that is meaningful and useful. The second kind of gap that can exist is with knowledge transfer problems. So you've asked the right questions, you have the right evidence, but there's a gap in getting that evidence into practice. And this is where you would use end-of-grant KT activities to move that evidence into practice.
So in the patient engagement platform, my colleagues and I have routinely been asked, so how do you do it? How do you go from understanding the theory to actually engaging patients in a meaningful way that is helpful in the research enterprise? And so there are a number of different types of frameworks, different platforms, lots of different approaches that are out there. And we went with the simplest one we could find. So this framework is based on the United Nations Environment Program. They designed an entire kind of 200-page approach to stakeholder engagement. And so what we did was distill that and really focus on engaging patients in health research. And then through partnership, working with Diane and the KT platform, we started to look for the similarities in terms of how you engage other knowledge users. And what we found was our KT colleagues were getting a lot of the similar questions that we were getting in patient engagement. And so that's how Diane and I sort of came to be sitting next to each other today, and how we kind of co-teach a workshop based on this. It's really trying to leverage the areas that are similar. So it's a 3-step process we're going to talk you through today. This is a key takeaway point that we'd like you to remember. The very first question you ask yourself as you get into thinking about engaging patients and knowledge users in your research is, why am I doing this? So how will engaging patients and knowledge users impact your research? What's the rationale? Once you're really clear on that, you can move on to who, and understanding who needs to be involved. And then the last one is sort of that tactical application. So what are the techniques and methods that you can use to engage those people for that purpose? So why engage patients in research? So healthcare without a patient's active voice is no longer really an option. Several funding bodies, as well as research ethics committees, peer-reviewed journals, all now require researchers to identify and describe their plans for engaging patients in health research. Some of the rationale that we've heard from researchers who have undertaken this, in addition to it being required, which is a completely fine starting point. If you are in that boat, that's okay. As you move along the continuum, you have your first experience, you learn some things about it. What we found is the benefits for researchers are an increase in the quality, relevance, and effectiveness of your research. Also, it increases participation and rapport with patient communities. So it starts to make, repeat recruitment a little bit easier and a little bit easier to do over the course of the study in terms of retention. There are also benefits for patients. So if we have any patients who have joined us today, there's an increase in confidence, feeling empowered and valued, and an increased trust and understanding of research and the link between research and improving health outcomes in the broader system. Decades ago, somebody coined the phrase, "nothing about me without me," and it has been adopted and utilized broadly since then. We like it in terms of patient engagement because if you think about the knowledge that you acquire through a health experience, it is sort of a tacit knowledge that is the only way that you can acquire it. Personally speaking, I spent 15 years working in healthcare. It wasn't until I sort of spent 2 years being a patient that I really began to understand how the practices that I had been researching previously came to fruition and what some of those challenges were, and it gave me a completely different perspective. So engaging patients is pretty key.
Thanks, Lisa. That's a really good description of why you would want to engage patients. So why would we want to engage other knowledge users? So when we think about patient-oriented research, it's really important to bring in individuals with a different lens because we all apply our own lens to whatever we're doing. And so by engaging other knowledge users, you bring in another lens where they can look at things with their unique understanding of the problem, the context, and the environment, their lived experience as being members of an organization, of a community, as well as their experience, their professional experience. So all those different perspectives will help you look at your research through a different lens and potentially identify where there's gaps or where there's biases. Bringing in these other knowledge users can help identify facilitators and barriers both in the execution of your research, but also in the implementation of the results. And it's really important when you start looking at trying to get these results out to your different audiences to make sure that you've got representative members of those audiences so you can tailor messages that resonate, that are relevant, that are viewed as credible and valuable to those different audiences. And you can tailor interventions for the different contexts that you are working in. And again, a lot of researchers don't have the resources or the systems in place to really develop and execute those dissemination plans, and that's where your other knowledge users can provide support, because they may exist within the system. They have different resources. They have different structures and supports that can help with that dissemination or implementation. And very important that they can help with evaluating the implementation process and outcomes, because it's really important that as we implement this evidence that we are continually monitoring and evaluating and looking for what outcomes are occurring and looking for unintended consequences. So again, they bring a different perspective. They potentially bring skills and resources that will really help your research become more effective and meaningful.
And so where research really starts to become effective and meaningful is in the idea generating phase. So our platform conducted 2 scoping reviews looking at priority setting and agenda setting and the techniques and approaches that are used in order to achieve those. Ultimately, what we learned from undertaking that research synthesis was that your research question really needs to address what the end user values and has to be a fit with their priorities. Some of you may have heard of approaches like the James Lind Alliance. That's a validated patient engagement process whereby researchers, clinicians, and patients come in equal numbers to the table, have an equal voice, and it's a priority setting exercise where at the end of a significant period of time, in this particular case, you end up with a list of what the top researchable areas are based on a consensus building between those 3 potentially diverse perspectives. There are a number of other methods and approaches that we'll talk about later and in our meta workshop on the 21st of November. But at this point, it's sufficient to say that your research idea should be, where possible, developed in concert and partnership with the people who are going to be the end users of that research.
Yeah, and I think too, it's really important when you start looking at developing a research question, really engaging your other knowledge users to identify, what the gap is. Is there a gap between current state and, best practice? So by engaging your other knowledge users, you identify, is there a gap? What is that gap? And is it a priority to address that gap? So those are all really important things to consider when you're developing your research question. And your research question is a foundation for your research, and it's really important to get it right, because at the end of the day, we want to make sure that that research question is addressing a gap and you're going to get evidence that's going to be relevant and meaningful for your other knowledge users.
So we do a really good job here in Canada bookending the research process. So generating research ideas, building that consensus. I think since the late 90s, KT's really helped drive that idea of having those end users involved. That's had a trickle-down effect for patients. And we'll talk later about the research findings. Where we're not as adept is in the middle of this process. So in terms of research design, and we'll move to data collection and data analysis. However, the opportunities for patient engagement here are, as you are prioritizing and selecting a methodology, is it culturally appropriate? Is it sensitive to the needs of patients? Is the population that you're working with particularly vulnerable, or have some things that need to be kept in mind in terms of, the drain on their time from the illness that they're experiencing or the experience that they have had? Is there a potential for re-traumatization? So as you're going through your research design, engaging patients in that particular element can really set a benchmark for success in terms of making sure your methodology is meaningful and appropriate for the target population of the research that you're doing.
And I think that for knowledge users that goes as well. You know, I have experience working with physicians, and really important if you're working with physicians or other healthcare providers to find out what outcome measures are important to them. So, you know, you might have a clinical practice guideline or a clinical pathway, you know, that looks at one outcome, but for physicians, what we found is it really was looking at patient outcomes that were important. So there could be all these other indicators that might align, you know, with clinical practice guideline. You know, an example is looking at percentage of TXA administered to patients undergoing total hip replacement and total joint replacement. So that was something that we could measure that related very nicely to the clinical pathway. But what the physicians wanted that went one step further was, okay, well, what are my patient outcomes? What percentage of patients are actually getting transfusions? So again, I think really important to make sure that we're engaging these other knowledge users in the process so that, number one, we're using their expertise to design a methodology that's rigorous and relevant, and identifying what outcome measures are going to be meaningful for them and impactful and going to motivate them more to hopefully move that evidence into practice.
Mm-hmm. Moving into data collection, what we often hear as pushback is, I've spent years training how to do this. How can patients help collect the data in a meaningful and robust and rigorous manner that will allow us to sort of go forward and put our findings into peer-reviewed journals? Here in Alberta, we sort of have a real luxury in this area because there's a program at the University of Calgary, but they do work across the province of Alberta called PACER. And so these are patients and community engaged researchers that undertake a rigorous training program to help marry their tacit knowledge as a patient with research knowledge in terms of collecting and analyzing data and applying it to a specific research question. So if that is something that you are interested in doing in terms of incorporating patients at the data collection level, that's certainly one option that we have here in Alberta. There are other options in terms of, partnering with patients, providing some coaching in terms of how to do that, particularly if you're working with vulnerable populations, doing that in partnership. Similar to co-design in the research area, that gives your presence in that community a higher degree of legitimacy and a higher likelihood that you'll get the results that you're looking for in that area.
Yeah, thanks, Lisa. And I think too, just recognizing in Alberta that we actually have really good access to data. And so if you engage your knowledge users, you may be able to identify sources of where data is already being collected, which may align with the data parameters that you want to collect. So for instance, we were doing a study where we were having nurses fill out a survey to collect patient outcome information. So we engaged all the stakeholders. So we had anesthesiologists there, we had the nurses in PACU as well in day surgery, we had data analysts there. And what we were able to identify by engaging all this broad group of knowledge users is that some of the outcome measures that we were looking at were already being collected. And so we were able to reduce the amount of work that the nurses had to do significantly by about half. And so by doing that, number one, we were able to collect the data much more efficiently and accurately. And number two, we were able to get much better buy-in from the nurses because we reduced the amount of work that they had to do by about 50%. So it's really important to start looking at the different things that are happening in the province, and to recognize that by engaging these different knowledge users, especially within our context where we have a really good access to data, that there may be opportunities to leverage that with secondary use of data for your project.
In terms of data analysis, this can be genuinely interesting to hear the perspectives of patients and end users on why particular themes and streams arise in your data. One project in particular had patients look at potential rationale behind no-shows for clinical appointments. And in terms of looking at the data, patients were able to pick out a trend based on the bus schedule and public transit availability that the researchers basically to that point had no explanation for, and that sort of wasn't where their line of thinking went. So it provided a new stream in the data analysis to help begin to understand things. The application of that data then went to change the clinic hours so that they were more aligned with public transportation hours, and the rate of no-shows was cut by 3/4. So having that kind of perspective incorporated is fairly essential in ensuring that you have as comprehensive and robust a set of an analysis that is possible.
In terms of data analysis, again, really important to engage different knowledge users, because there's so many different ways to analyze data, and so you want to make sure that you're understanding what findings are important to different audiences, and that the methods that you're using to analyze this data are viewed as credible, and that the way you interpret the research findings are, it's through a rigorous and relevant manner. And again, in terms of interpreting findings, really important to consider what's important to your different audience and how you present that information back. So again, what's important to practitioners will be different from what's important to policymakers or decision makers, and how you present that data back should be potentially very different, because you want to ensure that it resonates with the specific audience, and the way that it's presented and interpreted aligns with their interests. So again, very important to engage different knowledge users in this process.
The research findings is where patient engagement and KT really become good bedfellows. So in that regard, developing your messaging, looking at who the end users are for that. Patients are only one of a myriad, and think back to that sort of word cloud that Diane showed at the beginning of this piece. Looking at that, you saw patients being at the center, being at the core. They are often the end recipients of research findings in some way, shape, or form. So working with them to understand, do the words make sense? Are they jargon heavy? Is there a clear understanding? If you're looking for patients to sort of change their approach in particular areas, having them involved in really providing clear messaging on those research findings is key. And Diane, I'll hand it over to you to sort of talk about the application to the other end users at this point.
Mm-hmm. So again, it's important to recognize that for different audiences, there will be different key messages. You want to ensure that your key messages resonate with your audience. And Choosing Wisely Canada has some good examples of, messaging around different recommendations for patients as well as for health practitioners. So it's good to look at some of the things that are out there. A lot of the clinical practice guidelines for the Task Force for Preventive Health, I think it's called. Again, if you look at the materials that they generate, the messaging is very different for patients versus healthcare practitioners or other audiences. So it's important to have representatives from those different audiences to make sure that the messages that you're presenting resonate. And in terms of developing a dissemination strategy, again, most researchers don't have the time, the resources, or the expertise to necessarily develop and then implement a dissemination strategy. So by engaging those knowledge users, you are gaining access to resources within the system to help to implement your evidence into practice.
So in terms of percentage of the time that we're going to speak with you today, you'll notice that we spent a long time in the why. And what we find from a consultation perspective is this is often where the least amount of time is spent. So a number of the calls that I will receive are, hey Lisa, we'd love to do a World Cafe to get patients engaged. And so what I often end up doing is walking researchers through the dialogue that Diane and I have just had with you to sort of really back things up and really sort of understand, why do you want to invite people into the research project, onto the research team, or engage in the type of research that you're executing. The next section we will go through much more quickly. It's much more straightforward and much more familiar, I think, for a lot of people. The visual on the screen at present is from the Mental Health Commission of Canada's Innovation to Implementation Guide. And you see at the center, it says person with lived experience. that could say patient. If we were in Australia, it might say citizen. If we were in the United Kingdom, it might say public. As you go forth as researchers to look for information about engaging patients in your work, one of the problems you will find is there is not a common lexicon for how to describe and talk about patient engagement. So please be aware of that. We've purposely showed this just to tweak that for you, that sometimes we say patient, sometimes it's person with lived experience. There is no uniformity sort of in the literature around that at present. Diane, did you want to talk a little bit about the other end users at this point before we jump into unpacking this?
Yeah, I think that this picture is just a good reminder of these key categories of stakeholders that we want to think about engaging. So your policymakers or government, it's important to understand what their priorities are, because that will help you identify, whether your research question aligns with the priority area. It's important to understand what other research you're doing and consider who they are. And then your providers are the people that will actually eventually potentially have to implement the evidence that you're creating. And I think that Lisa's covered up on caregiver and community.
So in terms of engaging patients, think about inviting patients to the table the same way you would when you're looking at other aspects of your research team. So you prepare often job descriptions or profiles for statisticians and for qualitative researchers, that type of thing. Similarly, when understanding who to engage from a patient perspective, really look critically at your research and the why that you've just spent all that time articulating, and then make sure that you have a diversity of patients that you can invite to the table. Diversity in terms of gender, in terms of their expertise. So for example, if you're doing a breast cancer research study, you might want some who are newly diagnosed, some who are currently going through treatment, and some who are in remission. So expertise, socioeconomic levels, and demographics, and really making that effort to engage patients that may be considered in the hard to reach populations, so that you do have that diversity of perspectives. Also looking at the different level. So in terms of at an individual level, these might be people who are currently living their health experience nightmare, as it's sometimes described to us. They may be caregivers who, have lived through it, or have survived people who have lived through it, depending on the type of research that you're doing. Patient support groups as well. So all of the disease charities, for example, often maintain a patient support group that you can go to with a request for whether or not there might be people who are interested in helping with your research. Then looking at an organizational level. So here in Calgary, for example, patient organizations like Imagine, where patients have mobilized together with a mandate for impacting the health system. Likewise with community groups and associations. So we've had a number of researchers work through the community leagues in Edmonton, or the community associations here, as ways of recruiting patients sort of to come into their research. And then the public at large.
So who do you engage in terms of knowledge users? I think that really it's doing a lot of environmental scanning, and doing that environmental scanning early on in your research. Because if you can identify some of your champions or opinion leaders in your research area, they can then potentially help identify other researchers who may actually be working on a similar project. And then there's the opportunity for collaboration, shared databases, different things. So really important to do a lot of environmental scanning at the beginning. And this will identify those key knowledge users. And when you start identifying these key knowledge users, it's really important to look at the fit of those knowledge users within your research project, because a good fit is essential in order to have a productive relationship. And use both formal and informal methods. Those informal methods where you're having discussions with colleagues, attending conferences, meeting different people, can be extremely valuable in building relationships, building trust, building credibility, because all those things are really important to establish good relationships with your knowledge users, and that will increase the fit with your knowledge users with your research project. And you can also use formal methods, so you can do surveys or questionnaires to identify who you may want to engage. And then in terms of, who to engage, again, as Lisa said, we're aligning this with what she discussed with the patients, but consider who you want to engage at an individual level. So other researchers, healthcare professionals, practitioners, who you should be engaging at an organizational level. So again, in Alberta, we have quite a complex healthcare system. It's important to do some environmental scanning and figure out who is at different levels within the organizational structure. So your strategic clinical networks, just even individuals within different hospitals, within different regions, within different zones. And again, different individuals within universities, within industry, professional organizations. These are all organizational level structures that you want to think about. Who do you engage within those structures? And at a population level, important to understand what are the priorities for policymakers? What are the priorities for research funders? Because again, that will have an impact on your research. So when you start looking at who to engage, this is a 2x2 structure that you may have seen from project management. But when you start engaging knowledge users, they all are going to be impacted by your research, and they're all going to have varying levels of influence and power and interest. And so it's important to understand that your knowledge users that have a high degree of influence and power and interest, you want to engage them closely. These are the people that can be the champions. They can really help to move your research forward. Alternatively, these are also the people that could potentially create barriers for your research project. So when you're looking at all these different knowledge users and identifying who you want to engage, it's important to do some informal assessment of their power and interest.
Ultimately, go where your people are at as well, I think is a key point. And that sort of bleeds us into anyone who's done change management. ADCAR is sort of one of the core tenets there. You see the D is highlighted. It's often the one we spend the least amount of time on. WIIFM stands for what's in it for me. And that's a question that you need to answer in terms of each of the knowledge users, patients, policymakers, community members, understanding why they would like to be involved and tailoring your messaging appropriately is essential. Now, imagine that we had said everybody who participated in the webinar today is going to join Diane and I in Hawaii on the 21st for the Meta workshop. But then at the end of the webinar today, we said, well, really, we can only have space to take 2 of you. So what I've done there is change your expectation and your reality. Initially, you were completely excited about that, and then I took it away. So the reality of the experience is less enjoyable. However, at the start of the webinar, you had 0 expectation that you were going to Hawaii, so the expectation and the reality were much closer. As you go through your research, take the time to understand what you are expecting from each of your knowledge users, patients, community, other researchers, etc., and then try and make the reality as close as possible to those expectations. When there is a gap, and we just picked a random chart, I'm sorry if there's anybody here who is a data expert, it literally has no meaning. It's just a chart that had a space between the blue line and the red line, okay? The farther apart those blue and red lines are, the greater the degree of unhappiness, both for yourself and for the people that you are attempting to engage in your work. The IAP2 spectrum, IAP stands for International Association of Public, and there's a 2 because the second P is for participation. The chart on the screen right now was adapted from IAP2 by Virginia Vandell Walker, who's the lead of our platform and works out of Athabasca University. Basically, this shows that not all engagement is needing to be at sort of the kind of empowered thing where you surrender parts of your research project. It's quite possible that you're consulting with people. So you're merely asking for feedback and advice under no obligation to take it, right? So you're just looking to help understand those different perspectives. Our platform did a needs assessment of patients within Alberta, and about half of them said they just want to participate in research. And sometimes, we don't cover that off. We just talk about consult, involve, and collaborate. But it's important to understand that that is a really meaningful way for patients to participate in the research enterprise. Ideally, what we're talking about here is the consult, involve, collaborate, and eventually leading and supporting pieces. Looking within your research project, it's possible that at the research priority setting stage, you're collaborating. So people are equal partners with researchers and other knowledge users. Everybody has an equal say at the table, and then you come away from that with a joint consensus on what the researchable question is. But as you move into research study design, perhaps it's a consultation. So the level that you choose does not have to be consistent for each of the phases of the research process. We're going to look at what does it take to actually do this. So Ping Mason Lai, who's the associate director of our platform, did a lot of work looking at, what does it actually take to do patient engagement, and what are the competencies that researchers and patients require at each of the levels in order to be able to meaningfully execute the sort of tactics and approaches that we're talking about. So you'll see in the chart in the center, at the consult level, it's really about listening, plain language, and the ability to kind of onboard feedback and learn about the process that you're being involved in. Diane will talk a little bit at each of these next slides about what some of the strategies are for undertaking engagement at each of the levels that we talk about.
And I think that, we're not going to spend a lot of time on this because our workshop is really going to drill down into how to at each of these different stages. But what I would say is it's really important to identify pragmatically what are the resources available, what expertise do you have for each of these strategies. And also, to look at what's already in place and if you can leverage things that are already in place. So for instance, you may be able to leverage a continuing team meeting to actually conduct a focus group. So what I would say is it's really important to look at, how you engage at these different levels, what you want to get out of it, and then align the strategies, with existing resources and be pragmatic in terms of what resources you have at your disposal.
As we move to the involved level, the real differences around are clearly articulating roles and responsibilities and the ability to craft meaningful relationships with people, because you're now going to accept the feedback that you're receiving and see a shift in terms of how you approach your research. At the collaborate level, what we're really looking at that point is co-design, co-develop. So this is where, as patient engagement professionals, this is where we hope that at least one component of your research will go there.
And again, for CIHR, this is the collaborate level is the level that's required in order for it to be integrated KT.
So we're very lucky today. We have a colleague of ours from the patient engagement platform, Robin in Edmonton, and Robin was the liaison to the BEDMED project. And this was a kind of a very involved patient engagement piece. So Robin, if I could turn it over to you just to speak for a couple of minutes about patient engagement in practice and what that looked like.
Sure, thank you. For having me speak to the BEDMED project. It was a project that I had absolute pleasure and helping with, and continue to be quite pleased with how it's going. What I wanted to speak about was mainly the coaching and mentorship that I provided to the study coordinator of this BEDMED project. Excuse me. She kind of came to me and said, that's great, we kind of know about patient engagement, but now what? What do I really do? How do you really do patient engagement? So with knowing that we have limited time, I just wanted to run through a little bit of what I cover with regarding how to do patient engagement well and to reach to some of those levels of the collaborative partnership. So the first thing that we did was we reached out to patients. through our patient family registry, which I manage through our patient engagement platform. We use social media. We reached out to patient groups. This particular project was looking at working with people with experience of hypertension. So high blood pressure, either people with the direct experience or caregivers and family members. We eventually found and rounded up about 10 individuals to sit on the patient working group, which became part of the extended research team. These meetings were to happen once a month and to be at first sort of a, let's see what the group thinks, what they want their roles to be. But the idea was to sort of co-design a lot of the study materials. That the research question was already decided. However, the consent form, the mail-outs, the questionnaire, these are all things that the patients in the working group, there was about 10 individuals, helped the original research team co-design. It's worth noting that we recommended, look, this is about collaboration, partnership, relationship building. You can't do that if you're not in the room with people, if you're not directly on the phone with people, if you're not reaching out to people on a very human, friendly level. And it was our recommendation that the research team be present for these monthly meetings, and that includes the principal investigator of the project, as well as the study coordinator who I work closely with. Part of my advice to this person was she had quite the role to play. She wore many hats. So she was the study coordinator for the project. She was the chair of these patient working group meetings. She was the contact person and the patient, what we call in patient engagement platform, the patient liaison role. So she was the sole contact, and for consistency, we always kind of recommend you have somebody on the research team as this patient liaison role. This is a position that can be budgeted for, probably should be budgeted for, and they're the ones that are the friendly face, the project experts, and who will work directly with the patient partners. Some of the advice I provided to the study coordinator also was always speak in plain language. I continue to work with research teams, and this continues to be the largest challenge. You're often dealing with different cultures and different levels of experience and education, and kind of creating a basic language that everybody can understand and feel comfortable with. It's so important, and it's sort of that first step to creating the safe space so that patient partners feel very comfortable engaging very meaningfully and actively in the work. Another issue was meetings. Nobody wants to attend, especially if you're a volunteer, if you're a patient partner volunteering your time, nobody wants to attend really long and boring meetings that perhaps don't have clear objectives. My suggestion for the study coordinator for BEDMED was always have a nice clear agenda. Make sure everybody knows the roles and the task at hand. What's the objective of today's meeting? Are we going to tackle the consent form? Are we going to create part of the questionnaire? What are we looking at with the questionnaire? Is it the wording? So just being very clear and open about the goals. I think that this is an important point too, is as this patient liaison role, the study coordinator, they often play the role of a listener. I think that sometimes we have this urge to teach and to speak, and when you're dealing with patient partners, I think it's really important to also remember to step back and take that listening role. You're learning from their experience, they're volunteering their time. Out of respect, making sure that everybody has say at the table. There's different games and types of facilitation techniques you can do to ensure that everybody speaks. You're always going to have some people who are really engaged, really passionate, and they kind of dominate the conversation. And you're going to have folks who maybe are a little bit more quiet. So naming everybody and giving them the chance to speak or to pass on comment is really, it's a great thing. And I also just wanted to add in kind of closing that the BEDMED project will be featured at our November 30th speaker series. So everybody's welcome to join this. It'll be online and in person at the University of Alberta. So thank you, Diane and Lisa. If there's anything you'd like me to add, just please let me know.
Robin, that was wonderful. Thank you for sharing that practical experience that you had with that project with everybody on the call today. And we'll make sure we send the ad out for that speaker series so that everybody has those details and can register. Just to reiterate, in our closing, what our learning objectives were today was basically to help you be able to explain in your own words what patient-oriented research is. So again, engage patients as partners, focus on patient-identified priorities, and ultimately apply that knowledge to improve health outcomes.
And, in terms of integrated KT and patient engagement, integrated KT is an approach that engages knowledge users in the research process. Patients are knowledge users.
So, why engage patients? Nothing about me without me.
Why engage other knowledge users? Close the knowledge production gap. Ask a research question that is going to be relevant so that you're producing evidence that's going to be relevant and meaningful and useful.
So we have a little bit of time left for questions. Denise, do we throw that back to you?
Yeah, I can read off questions. So just a reminder for the participants, if you have questions, please type them in the chat box, which is in the bottom right-hand corner of your screen. And I'll read them off and our presenters can reply. So just, I can see that some of you are typing, so while those questions come in, I'll go back to one that came in through the chat box earlier, just around engaging with hard to reach populations. And I know this is a large area, but maybe we can just touch briefly. So there's a couple of questions here. How did the researchers engage participants to interpret the findings for no-shows when I assumed that the participant population was hard to reach? And the second question is, are there any suggested methods for data analysis or interpretation that engages hard-to-reach knowledge users or patients?
Great question, Kathy. Thanks very much. Diane talked about environmental scanning and the importance of that in terms of determining who you're going to engage. In this particular project, the environmental scanning uncovered a trusted community organization that had existing relationships. The research team approached that community organization as a standing champion and asked whether or not they would be willing to broker that relationship with the hard-to-reach population. They were amenable to that, and the researchers had budget to provide compensation to the people who provided their time in that particular example, and that was how they did it in that particular one. In terms of suggested methods for data analysis and interpretation, I just want to pick up on something Robin said, ensuring that everybody has a voice at the table. And a lot of funding agencies now require a lay summary of the work. A similar process for generating lay summaries can be used in terms of data analysis and interpretation. So I think that's a longer conversation than we have time for today, but I'm certainly more than happy to have that. Just contact me via email after the webinar and we'll set up a time.
Yeah, and I think that Lisa raised a really good point. It's really, that environmental scanning, it's identifying who your champions are. Because, for you to go and approach a group of practitioners or a hard-to-reach audience is very challenging. It's very difficult. These are all busy people. They have lots of other things going on. But if you can approach that difficult to reach audience through a champion that is going to be advocating for your research, it's much easier to create that buy-in and make it easy for them. As Lisa said, the more that we can do to make it easy for these individuals that we want to engage in our research and more relevant, the more likely that they're going to participate. So it's really looking at making it easy and looking at the what's in it for me from their perspective.
Great, thank you. That's a great answer. We've had another question in about upcoming SCORE workshops and whether there is a registration fee or not. So the workshops from the Knowledge Translation Platform, the meta series that was advertised earlier, there is a small charge for each one. The way the series is structured is that it's a number of 3-hour workshops over the course of the 2.5 days, and there's a small charge for each one. So you can let us know you have more questions about that. And now we have another question or a comment from Selena Alou about using the KT game, which I'm actually not familiar with, but she recommends it as an interactive and fun way to give people around the table, give everyone a voice. She says we've used this strategy at meetings and it has worked out well. So thanks for that recommendation, Selena. Okay, so we have time for one or two more questions if anybody has any, or if Lisa or Diane, if you have additional points that have sprung to mind as now that you've sat back and had a chance to reflect a bit.
Just to say that the upcoming workshop really will take the sort of theory of patient engagement and IKT that we covered today, and the workshop's all about you. So we've asked people to bring whatever work they're currently doing, and the output for participants will be a draft patient engagement and IKT plan. And so it really is focused on the participants in that workshop. Diane, anything you want to add about that?
Yeah, I think, the workshop, I think, will be extremely valuable because this is really, when you start looking at engagement of patients or other knowledge users, it is so context specific. And so I think the opportunity to come into a research where you actually, are working with other peers and colleagues, you learn from each other, and hopefully we can provide guidance as well. But it's really important to look at your context and to go through this process and to ask these questions. And so we can give you all the theory in the world, but a lot of times, unless you have that dedicated time set aside and an opportunity to discuss these questions, it's really hard sometimes just to find the time to actually draft a plan for engaging these patients and knowledge users. And from my experience, the projects that have been most successful for me are the projects where I've done a lot of time in the planning stages, where I've done a lot of environmental scanning, and where I've had a strong champion. So again, the time in the front end on the plan can be really critical to a successful project.
Super, thanks. Okay, I saw a couple of names coming up as typing, but I don't know if people are still putting in questions or not. So we're just cruising into the final few seconds of today's presentation. So I'll move to thanking Diane, Lisa, and Robin for their great presentations today. And a thanks as well to all of you webinar participants who joined us today. It's been great to see the level of interest in this topic. So for anyone who came in late, I'll just mention again that the session has been recorded. The link to view the webinar will be emailed to all registered participants, and the recording of the webinar will also be archived. So if you want at some point to look at it again, it will be there in perpetuity. So just mentioning as well the workshop on how to engage patients and knowledge users, which will be presented by Lisa, Diane, and as well Dr. Gabrielle Zimmerman, the Knowledge Translation and Implementation Science Coordinator for the Alberta SPORE KT platform. And as Lisa and Diane have already mentioned, this will build on the brief topics, the topics that have been covered briefly today. So the workshop is on the afternoon of Tuesday, November the 21st. And a link for registration will be sent around with the materials. And just to answer the question that's popped up in the chat box, yes, this is an in-person workshop, just due to the nature of it's a very hands-on structure, so it lends itself better to being in person. So on behalf of the Alberta SPORE Knowledge Translation Platform, I'd like to wish you all a great afternoon. Thank you for joining us, and we hope to see many of you at the workshop later this month.